Okay, participants are being added to the webinar, so we'll just hold for a couple minutes while everybody's being added in. We'll just continue to hold for a minute or so while people are still added into the webinar. Okay, it looks like it's slowed down. Elena, I'm going to go ahead and get started. Hello, everyone. I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. I want to thank you for joining us today on our Roadmap to a Healthy Reopening webinar series. We're going to be focusing for the next hour on the retail industry, and I thank you all for joining us. I want to thank our partners in this endeavor, Parkview Health, the Northeast Indiana Regional Partnership, the Allen County Department of Health. I want to say special thanks to Dr. Deborah McMahon and Mindy Waldron from the Department of Health for their great leadership in guiding the community through this pandemic. Also Heather Schegler at Parkview, the staff here at Greater Fort Wayne, Inc., and the staff of the Regional Partnership. A great deal of effort and time has gone into putting this series together, and I want to thank them for that. We're proud to be bringing this critical information to our business community. Just a couple housekeeping items. We will be using the Q&A tab at the bottom of the screen later in the session when we get to questions and answers, so you can use that tab. All participants will receive an email with a survey immediately following this webinar. We ask you to please fill that out and send it back in. And then you will be receiving a separate email that will contain a link to the recording and the presentation slides that are presented here today. I want to thank all the participants for submitting your questions in advance. They served as a guide to the Parkview team to develop the content for this specific retail webinar. While you may not hear your question asked the exact same way, we hope that the information we share will address your pressing issues in your industry. I'd like to introduce the Parkview participants. We have Jolynn Succo, the Chief Innovation Officer. We have Dr. Jeffrey Board, Chief Safety and Quality Officer. We have Dina Jackway, Chief Community and Human Resources Officer. We have Dr. Mike Knipp, Parkview Total Health Chief Medical Officer, on the call with us today. Jolynn, I'll turn it over to you.
Thanks, John. Like John said, I have the privilege of serving as the Chief Innovation Officer for Parkview Health. And I want to start this off by saying thank you for all that you have done for us as we've been there for you. So thank you for staying at home to slow the spread of COVID. We've really been overwhelmed by the generosity of our community throughout our region. We've received hundreds of cards for coworkers and patients, distributed thousands of meals donated for coworkers. We were moved by the flyover, the 122nd Fighter Wing, and the socially distanced prayer vigil. We are humbled by your generosity. I also want to share a little bit more about how we're doing as a system. As you can see on this slide, our COVID impact meter, we are cautious, but we are not in crisis. And we have really not been in crisis over the past 60 days since we've opened our incident command. We've been continuing to take care of patients, and we're starting to see the number of hospitalized patients with COVID plateau. And more importantly, we're seeing patients come back to our emergency room in the last couple of weeks. And this is incredibly important because we're seeing patients delay needed care. So we often talk about the surge of COVID, but we also think that there are a lot of people who need our care. So we're hopeful, and hopeful to get back to business. We, like you, are beginning to think about how we begin to safely open up the parts of our operation that we've suspended due to COVID. And we're also really thinking about how does the world look different today than it did 60 days ago? As we think about this, there will be important considerations that will guide our actions. First, we are going to continue to have positive cases of COVID in our community. Any vaccine, we are 12 to 18 months away from, and there is no herd immunity yet in Northeast Indiana. We expect that it's going to be a little bumpy as we reopen. We also expect some resurgence, and we want to do all we can as a community to keep these surges as low as possible. We're also operating in a world where the information we have is evolving and incredibly dynamic. We are implementing safe practices that will help our coworkers, customers, and community. And we also know that crises like COVID challenge us to think differently, innovate, and emerge stronger. We are spending and have spent hours thinking about how to open in the absolute safest way. As a community, you have been so generous with us, and today, we'd really like to return that generosity to you by sharing what we are learning and doing. You will learn more about our free service offerings later in the webinar, but one thing that we've created is a website to share what we've learned, as well as what others are doing in a variety of industries. This website is going to be a living document that will evolve as the dynamic situation of the pandemic changes. We have it full of workplace considerations and people considerations. We've also established a hotline with a one-day turnaround where you can ask questions from some of our subject matter experts about what we're doing here at Parkview. We want to stay in dialogue with you, our community, so that we can all open safely together. With that, I want to turn it over to Dr. Jeff Ford, who's going to talk more about how we're keeping our workplaces safe.
Thank you, JoLynn. It's a privilege to share information with you today, and we certainly hope that you find this webinar series and the materials that we are making available to you on our website helpful to guide your decisions as you determine the best way to reopen your workplace and to serve your customers. So let's start with thinking about your workplace. There is a built environment, there are spaces where employees work, where customers interact, and you engage in your business. And you need to start with thinking about that physical layout, that built environment. Do you have a space where you have a lot of customer traffic? Do you have workspaces that are employees only? Do you have break rooms? Do you have stock rooms? Retail floor space? Do you have a common area in the front of your establishment that may be shared by other businesses or is a public space? So start by thinking about that environment. And the other piece that you need to be thinking about is the community spread of coronavirus, COVID-19. And so what does that really mean? That means that the source of infection is not going to be pinpointed. When we see a patient in the hospital or in an outpatient clinic, because there's community-wide spread of COVID-19 in the United States, we generally are not going to be able to pinpoint the source where the person was exposed and picked up the virus. So we have to think about everybody in the community is at risk of infection. There is no herd immunity. This is a novel coronavirus, which means that anybody can become infected. However, in the population, there are people who are more at risk to have severe illness from the infection versus mild illness. Those are going to be older adults, and also people with chronic health conditions are at risk to become more severely ill with COVID-19 compared to people without those comorbid or chronic health conditions. When you think about workplace readiness, it's very helpful to look at this framework, which is called the hierarchy of controls. And this is one of the foundational frameworks of occupational health and medicine. And it starts at the top, and that's elimination of the hazard, removing the hazard. And this is the most effective strategy whenever it can be employed. Next down is engineering. So this is designing ways to isolate people, either employees or customers, from the hazard. Third down is administrative controls. This is changing how we do our work. So this is things like policies, workflows, employee and customer behaviors that you can use to help reduce the risk of the hazard. And last, that final line of defense is personal protective equipment. So these are things like masks, gowns, gloves, etc., eye protection in some cases. The important thing to remember about PPE is it is the last line of defense and should only be used in addition to all of the other elements of the hierarchy of control and be thought of as part of a larger picture. And it's very important that if personal protective equipment is part of your safety plan, that that the right personal protective equipment is used and that employees are trained on proper use, putting on, removing the personal protective equipment. So the CDC recommends that all businesses consider engineering controls, consider their building ventilation systems. It's important when we think about administrative controls to make sure that employees are properly trained on respiratory etiquette, hand hygiene, and you also need to look at that for your customers. So are there opportunities to use hand sanitizer in your establishment for both customers and employees on a regular basis? Are there opportunities for social distancing? Are there tissues available to help people cover their cough? Is a cloth mask potentially part of that solution if social distancing cannot be effectively maintained in your establishment? And finally, cleaning and disinfecting. And this is really a change. This is part of our new normal of coexisting with COVID-19 in addition to things like hand hygiene and social distancing. And this may mean that employees on a regular basis are cleaning their workspace, cleaning a public area, cleaning high-touch surfaces throughout the workday to help maximize safety and reduce the risk of horizontal transmission from contaminated surfaces. I want to spend a little bit of time to talk with you about testing. Currently, there are two types of tests that we use clinically. The first I want to talk about is antibody testing. This is a blood-based test, and its uses are for population surveillance to assess in large groups of people the prevalence of past infection with COVID-19. So this is being done right now by the Indiana State Department of Health in partnership with the Indiana University School of Public Health. They are testing a sample of individuals in every county in our state, and they're going to be able to determine what's the prevalence of past infection in each county. They're going to repeat that process every few months throughout a 12-month cycle. And over time, that allows you to build a bunch of information to get an understanding of where we have had the highest prevalence of COVID infection by county, and also inform things like public health measures and policy decisions at the local, regional, and state levels. It also has a role in certain types of clinical research. However, there are very important limitations to understand with antibody testing. First of all, currently, medical science does not know if those antibodies are in fact protective, meaning that if you have antibodies detectable on the blood test, we do not yet know if those antibodies will actually prevent you from reinfection with COVID. We also don't know whether or not that's going to prevent someone from being a carrier and being able to spread the virus to other people. The other thing that's important to recognize is that in order to rapidly bring as many tests as possible to market, the Food and Drug Administration waived or eliminated all of the standard requirements for diagnostic testing and went under what's called an emergency use agreement. The vast majority of tests currently on the market have had no evaluation or formal scrutiny by the Food and Drug Administration. They've never gone through a rigorous validation process through a licensed clinical laboratory. And as a result, many tests on the market are unreliable or inaccurate. And because of these important limitations, it is totally inappropriate at this time to use antibody testing for any type of individual return to work decisions. So we would advise against any form of mass antibody testing for individual return to work decisions. The next type of testing we have is PCR, and that is the nasal swab. This is something that we use to diagnose COVID-19 in a person that has active symptoms, that has the infection. This test uses a swab to the back of the throat, what's called a nasopharyngeal swab, to actually detect the RNA of the virus that is in the back of the throat. And so this test can be very specific to diagnose COVID-19 infection, but only if those virus particles are present in the back of the throat, and that's generally only going to happen when people have developed symptoms. In people that have no symptoms at all, this test is very insensitive, meaning that as much as 50 to 60% of the time, if someone has not yet developed symptoms, that swab test will be negative, and yet they could still harbor the virus and later pass it on to others. So false negative results are common in people without symptoms. So the other thing to remember is that this is just a snapshot in time. So all this test tells me is at the moment that I swab the back of your throat, whether or not you have virus. It will not tell me anything about whether you're going to have virus tomorrow or next week. It doesn't tell me anything about risk of future exposure, which means someone could have a negative test today and days later could become ill after being exposed after the swab has been taken. So this by no means, having a negative test at one point in time does not mean someone is not going to be potentially infectious at a future date. So when we think about the hierarchy of controls framework, the way we have been doing this at Parkview Health is we really emphasize the message, it's more than a mask. We think about the whole hierarchy of controls: elimination, engineering controls, administrative controls, and then finally at the bottom, personal protective equipment, when none of the other controls is going to be sufficient based on the context of the work being done. So I'm going to turn it over now to Dina Jackway, who is our Chief Community and HR Officer.
Thank you, Dr. Board. So I think we all recognize the last 50 to 60 days kind of feels like, as one of our local CEOs put it, it's like we're flying a plane and we're fixing it at the same time. A lot of unknowns and definitely trying to maneuver things coming at organizations such as retail, organizations such as healthcare, and our community at large. So as we think about people are the most valuable resource we have in an organization. And why that's important for what we're going to talk about today is it's really about keeping people well. And not just those that are coworkers within your organization, but those individuals, those patrons that are coming in, your vendors, your community at large, and how you're interacting. And so I think there's a few things we want to highlight for you to keep in mind. And the CDC has put out some great guidance, and the first of which is to have a workplace coordinator. Have someone in your organization who is responsible for communicating. We understand that not all of you in retail are going to have an HR department, and you're not going to have someone centralizing everything and being able to put things out. Identify someone who's going to do that, because during this period of time, communication is so important. You have all of your coworkers who are getting their information from a variety of sources, good and bad. They're going to get things from social media. They're going to see things on national news. And so you really want to bring it home to them in terms of what it means for them and being employed within your workplaces. So important to identify someone who's going to be that central source of truth for everyone. Implementing flexibility in your policies and your procedures right now. And in retail, you may not have some of those structures, but think about where you can be more flexible. The way that we've always done things will not work in the new environment. And so being able to step back and look at what your procedures and how you approach certain parts of your business may need to completely change. And frankly, they may be best practices that you carry on into the future. But it is something that you have to be flexible, especially because The world has changed for organizations. It's also changed for individuals. As an individual now having children, you might have your coworkers who have all of their children at home doing digital learning, and they're not able to work the same hours that they had done before. And so how can we be flexible, allowing individuals who have sick family members to have time off where appropriate, but obviously still leveraging what you need them for within the organization. Educating your coworkers on how to protect themselves, how to make sure they're protecting their families. That education, again, by that central workplace coordinator is so important because you're talking to them about the why. It's really important when you're telling them, you need to wear this mask, or we need you to do these things to help protect not only yourself, but the customers. But you also explaining the why will help really reduce fears and help reduce individuals from feeling like I can't come to work under these conditions. Consider also when you're looking at social distancing and your new normal when it comes to all your practices in your business around social distancing guidelines, how are you going to protect those that are vulnerable? So this is not only for those coworkers that you have that might have underlying health conditions, or they might be in a vulnerable population to where now we need to accommodate them a little differently so that they can continue to work and maybe doing something different than they've done before, but also your patrons. And we know that several businesses have accommodated those that are vulnerable coming in to a certain time frame, that they're coming in the morning or perhaps different hours. So it's something to think about as well in the retail environment. Are you going to have special times that those that are vulnerable can still reach the services and products that you're offering? On the staffing side, I'll refer back to just a comment I made about flexibility. And we know that you have a business and you have a job to do, but you also have coworkers who are going to need to maybe do something different than what they've done before. The roles have all changed. We know this in our environment in healthcare. Athletic trainers who are not in the schools right now and helping students get to tip-top shape, they're actually on a nursing unit helping, or they're in an office environment helping with programming. There's a lot of different roles that people are being pulled to do right now because it's what we need as an organization. So you, again, may need to challenge your coworkers to be doing some different work than they've done before. At the same time, we're asking them for that flexibility. We need to, in turn, be able to give them some flexibility because of childcare conflicts that they might have, or because they're taking care of someone, perhaps their parents, they may need to shift and flex. And so how can you come up with creative ways to do that and accommodate everyone? And what are you going to take away from the new normal to experiences that you'll give your customers in the future a little bit different? So having individuals, something as simple as allowing your customers to kind of run their own credit card, or different ways that you're going to be able to set up your environment and maybe moving things more online or more on demand for your customers. You may continue those in the future because they turn out to be a best practice and can create loyalty by your patrons. On the return to work process, just sharing with you what our process is on the slide. I won't talk through that in detail. With us having 13,000 coworkers, we needed to come up with a process that was going to centralize our return to work for our ill coworkers returning back. And so we created a hotline. May not be obviously needed in your organization, the size of organization you have. However, the point being here is make sure you have a return to work process. As individuals are sick or family members are sick, it's really important to make sure that as everyone is coming back to work, you're not only doing it to protect them, but obviously the rest of your coworkers, your patrons, and yourself. And so it is going to be important to have that return to work process that you'll go through for anyone returning after they've been ill. And then what is Parkview doing? Just a few examples that I would share that I think are good best practices that we've learned. Now, there's a lot of things we've done that may not apply to the retail environment. And we're happy to talk through any of these scenarios further with you. But a couple that we would take away that we feel would apply here is asking. simply asking your coworkers what they need. It's the voice of your coworkers that are really important right now, especially because we know they have fears coming back into the workplace. And so what do they need? What barriers do they have? What questions do they have? That should arm you with the types of communication and things you need to come back at them with. So again, we can address all the needs up front, but simply, it sounds simple, but yes, just simply asking your coworkers what they need is so important. Flexing benefits, and for those of you that provide benefits, what flexibility can we build in to time off practices, or to, I mean, there's a whole host of benefits that we've tweaked and changed simply because this new environment is new and different for us, and we want to be accommodating where we certainly can. And then finally, I cannot underscore enough, because everyone is different and because one size does not fit all, mental health right now is really important. Everyone is experiencing different emotions and different anxieties right now. And so as much as you can do, and we've got some great examples, I don't have time to cover that today. We can go into that further with you, but how can we provide more mental health services for individuals, accommodating and understanding what they're going through is unique for them, while still getting them back into the workplace through this recovery and restart of our businesses. So now I'm going to turn it over to Dr. Nip. Thank you.
Thanks, Dina. Okay, so Dr. Mike Nip, I just wanted to provide a couple occupational medicine, occupational health insights into the retail industry. There we go. So this slide, again, you'll see something we've already had up on the right side, the higher grip controls. What I wanted you to focus on here is the orange section there, with a couple points here. Any solution that you implement. Now, we know that you all are experts in creating your patron experience. You're the experts on your specific retail environment, but anything you approach and solve, it's trying to make that optimally safe and healthy decision very easy and very even automatic, if you can, for both your patrons and your coworkers. We want to stress also of looking at your own folks for innovation. That person who's going to unravel your Gordian knot, it could be their first day on the job and they have the insight that gets you to where you need to be. Another thing I would be very supportive and recommend is being very open and transparent with your patrons of what you're doing to ensure or optimize their health and safety when they come into your retail space. If it's signage, to say, hey, these are the extra steps we're taking, and front loading just how their experience may be a little bit different, and maybe how it's just it's a little bit better moving forward based on the extra steps you're taking to protect them. So what I wanted to share here for just a second, this is from the Toyota Corporation's document on what they're doing. So there's probably some spaces you think of pretty easily and consistently, which are where your inventory may be, your stock room, but also to think of other things, especially your restrooms. And just to, again, I think we usually see the wash hands before coming back, but also being, again, transparent on the extra steps you're taking for your employees and your patrons here. A simple solution I've recommended many times is even just moving your waste can closer to the door, so that person who's washed their hands has that paper towel in hand and then can contact that, what we're calling high touch area, with the paper towel instead of their hand, and then they can dispose of it, and they've avoided having a high touch area exposure. This slide here, what we're giving you a preview of is when you go to the site that Jolynn in a second is going to talk about a little bit more. Under the retail section, some links to some of the best stuff we've found to help you all with your particular space and strategies to optimize for your employee and your patron experience. Having said that, I'm going to turn it back over to Jolynn.
so we can help. We are very excited about returning the generosity that you've all shown to us back to you. And as we continue to operate in this pandemic, Parkview really wants to help leaders lead. So while you think about us as a healthcare organization, we're also the largest employer in the region. We operate 10 cafeterias, a police force. We have an extensive grounds crew, office areas, and frontline areas. So we are learning and leading every day in all of these settings. The dynamics of this pandemic are changing rapidly, which means our approaches are going to change as well. But we want to offer you coaching for a safe, phased approach to reopen your business. So whether it's a return to work process, an employee safety issue, HR practices and policies, or well-being, we are launching Parkview Business Connect. And it includes a webpage, and on this webpage, you can access helpful resources aimed at keeping people well and creating safe workplaces. You can connect with our leaders and subject matter experts, and this is free. We are really excited. One of the pages on this that I highly encourage you to visit is our Creative Solutions page, where we're going to be sourcing the best ideas from our region and around the world as this pandemic evolves. Right now, you'll see what we're doing, but next week it will look different and it will continue to evolve. We also want to learn from you and share your innovative and creative solutions. So here's how you access those. This will be up during the Q&A. You can also go to parkview.com Business Connect, and we want to open safely together as a community, and we want to continue to dialogue with all of you as we do so. So with that, I think we're going to move into our Q&A.
Jolynn, thank you to you and the Parkview team for all the information you provided. We are going to move into the Q&A section right now. We've got about half an hour left for that. So we did have some questions submitted early. I will remind you that the Q&A tab down at the bottom of your screen is open if you would like to submit questions to be asked. I'll start with kind of one that's pretty common. Should I require all my employees to wear a mask while they work? And if so, what kind?
This is a very common question that we've heard from many employers, and the key thing to consider is that hierarchy of control. So before you go straight to, I want to mask everyone, employees and customers, think about, what have you done to eliminate the hazard? What are your engineering control options? What are your administrative control options? How can you change the way you work and serve your customers to mitigate risk? Remember that PPE is the bottom of the hierarchy. It's that last line of defense. There are going to be situations where masks for what we call source control can be helpful. And that means that if you're going to use a mask for source control, that it's going to generally be a cloth mask and everybody's going to need to wear one. And that's purely to, if I'm the mask wearer, it's to protect everyone else around me, not me as an individual. So it's a different purpose than other forms of PPE, such as a respirator that might be worn if I'm working with toxic chemicals or something where I have fumes. So think about your state, local, and industry regulations around mask use. Think about your hierarchy of controls. And there are places where you can't have higher level controls. Masks may be appropriate. So if you have a very tight workspace that you can't modify effectively, then having masks on those employees for source control might be an appropriate solution. But think of it as part of a larger whole.
Okay, how do I make sure my employees are virus-free when they come to work? Should I be doing temperature checks at the start of every shift?
Unfortunately, there's not any universally effective strategy to ensure any individual, be that an employee or a customer or an outside vendor coming into your establishment, is going to be virus-free. One of the challenges with COVID-19 that we know from our medical literature studies published of people who have had confirmed COVID-19 infection is that as many as 50% of those patients will not have a fever at the time they present to an emergency department and get admitted with COVID-19. So fever is not a reliable symptom that every patient's going to have, particularly early in the course of the illness. So temperature monitoring has some very important limitations. So we should not be relying on temperature monitoring solely. We have to think about the hierarchy of controls. And what's really more impactful is making sure that all of your employees know don't come to work sick. Make sure that they're clear on the policies and process which they can call in if they might be ill, so they don't come to work in the first place if they're ill and potentially spread virus to others. There's some other important caveats with temperature monitoring in an employment situation that I want to have Dr. Nip comment on.
Sure, thanks, Dr. Board. So the other points to keep in mind, I'm calling it the tiny pebble large waves when you throw it into the pond is, so the EEOC did come out recently and say this medical examination can be performed by employers in the state of a pandemic. However, a temperature reading is a piece of protected health information, just like a blood pressure or something like that. So this information, regardless, has to be protected and documented somewhere, especially if it's going to be used to make a work decision. So it's that, so not even giving the accuracy problems, the efficacy problems of the way you do this. There's also considerations, how do you manage training someone to take temperatures? How do you have supplies? This would include PPE for the person taking the temperatures, because every viable way, the touchless scanners, an oral or an ear thermometer is going to break social distancing. The policy, if you do have one, has to be applied across the board from the owner or president down to the person who it's their first day on the job. Of course, if from a regulatory or corporate viewpoint, it is required to implement, there are ways to try and optimize doing that process. But again, it seems very simple or close to simple on the surface to just check someone's temperature. But when you get into the details of how it needs to be buffered and managed and maintained, it gets a little bit more complex.
Okay, thanks for that. How this is a good question. How do we socially distance in public spaces like the Waialae Bar Street Market?
It's a very good question. And really this talks about looking at the space and figuring out, and I think some of the examples that were earlier in the presentation from Toyota, think about how the space is used and the interaction between people in the space. So what are the visual cues that you can use so that you help remind and enforce social distancing? So that could be rope barriers, that could be things, markers on the ground or on the floor that are 6 feet apart to provide those visual cues about social distancing when people line up, for example, to make a purchase or to look at product. Limiting the number of people accessing the space at a given time. Looking for opportunities when you're at the register for cashless or touchless transactions. So some retail establishments have gone to a no cash option, and so that if that's possible in your establishment, that's something to look at. Putting up plastic barriers, I've seen this in a number of retail establishments to help protect the person behind the register. Having hand sanitizer available at those points where you have points of contact, making sure to clean those workspaces and having those visual cues. So having a box on the floor or something like that. So the people have a clear understanding of where they should go and how they should avoid congregating too close to each other.
So another great question is, how can you safely socially distance in a small retail space? And I'll combine a couple things here that some of our viewers have asked. Is there a standard on number of people per square feet, or is the 50% occupancy adequate? Thoughts on that?
I have a couple. I'll take a stab here. So I think, You know, the answer we have on screen there, you know, is there, with anything an elimination strategy, is there a way you can shift anything you're doing based on your particular product or products to an online or even a order ahead, and then you can meet that person at the door and have your person protected appropriately? Limiting how many are in your space. I know the space question has come up a lot as I'm watching there. How do you determine how many people should be in your place of business? Well, you can probably do the math and try to how many could be in there to maintain the social distance. Again, that may require you to reorganize how your products are stored because you just have using the space you have. I've also seen solutions of like we have one here, limiting how many people can come in. It's even, do you offer by appointment hours or limited hours, and you have people sign up to come into the store between whatever, and it's a more personalized experience, increases your engagement. And I think what it really is, it's an innovation opportunity that's basically been forced upon any industry, but especially the retail world. How do you recreate or evolve the retail experience for your customers to keep them safe? Retail evolution. I'll work on that. Retail revolution. I don't know, but just things like that, to look at things in a new way, because every business, I think, is trying to come up with the next new way and innovative way to do something. And this is an opportunity where we're forced for health and safety reasons, but also how do you move forward to be the best in your specific sector?
Now, another thing that really comes to mind, and this is very challenging in the retail world because foot traffic is not even throughout the week, right? So, you know, if you go to a retail location, what's going to happen is you're going to see lots of people, say on the weekend, but maybe not very many people on a Tuesday afternoon. So if there are strategies where you can spread out that foot traffic so that you have fewer people at any one time, but you still have, you know, same amount of foot traffic per week, but it's more evenly spread throughout the week versus 80% of my foot traffic on Saturday and Sunday. You know, those are just some things. Again, it's not always possible to control that, but if there is a way through your retail business to help spread out or load level your foot traffic in your retail area, that can be another strategy as well.
You know, retailers obviously have some unique challenges. How do I manage my inventory and sales of clothing? Do I allow people to try them on? Should I consider asking all customers to wear a mask to prevent coughing, sneezing? You know, is that a cheaper option than trying to continually clean everything?
Well, you know, certainly asking people to mask or requesting that is certainly reasonable given the CDC guidance on masking in public. I wear a mask when I go to the grocery store, for example, to pick up essential items. And I think that you can certainly ask or encourage that. And I don't know that it's something that, you know, it might be challenging to get everybody to do it consistently. And you're depending on, you know, the amount of customers you have and how much, you know, control you have over who, you know, people masking as they enter your establishment. I think it's a both and type of process. So masking is going to help. Cleaning high-touch surfaces is going to help. There's not going to be any one perfect solution. So I think you have to look at a combination of things. And that's why that hierarchy of controls, that layered approach, can really help maximize the safety in your work environment. As far as fitting rooms, again, that you're correct. That's a place where, you know, you'd have to think about frequent cleaning. You have to say to yourself, well, it is a convenience to the customer, but the customer knows this is the new normal, right? So you may say, you know what, no fitting rooms, but we're going to have a much more flexible return policy for sizing that people may not be able to try something on, but we're going to give you more leeway returning the item if it does not fit properly when they try it on at home.
I wanted to add just one. This was Dr. Board's insight on a prior webinar about masking and your employees. There was a question, I guess 2 parts, sorry. Do the employers need to provide the mask if that's their policy? I think OSHA would say yes, the employer has to provide any and all equipment that the employee needs perform their essential job tasks and function safely. The point on the mask is probably going to become part of a uniform. And we know uniforms need to look all the same. I think it's offering employees a little bit of leeway to say, can they bring something from home, but putting in very definitive bumpers on what those can look like and what they could say, if anything. That is one way to ensure that they are going to be representing your brand and your store the way you want it represented. It's just another thing to layer on with what we're all dealing with here.
So another thing to consider is that, cloth masks, for example, if you're going to ask your customers, patrons to wear a cloth mask, I would say your employees better be masking as well. Because if you have all the customers wearing a mask and none of your employees are wearing a mask, you're really not going to get any benefit in terms of source control. If your employees, if they have the same risk of having asymptomatic spread of virus as the customers do.
I'll remind everybody that we do have the Q&A tab open at the bottom of the screen if you have a question to submit. I'll move on to the next one. Could you clarify on the temperature checks at work? Is that a violation of HIPAA?
Okay, so it's Dr. Nip. So what I would recommend, again, there needs to be, if any new policy is going to be implemented, please seek your legal counsel to make sure it is meets all of those boxes. The thing would be, it's the transaction between the employer and the employee to say, yes, employer, you may have access to this limited amount of my personal health information in concert with this policy that applies across the board to everyone, every time, et cetera, et cetera. Again, HIPAA, in most cases, it's a minimum needed to conduct care. This isn't obviously a care situation, but it would be minimal sharing. Things that would need to be done, like I think I mentioned, is how is this recorded? Is it on a paper sheet? Is it in a file? In the medical world, we have to demonstrate in case we are audited, is this information behind lock and key, so to speak, password protected, or it's actually in a file cabinet that only one person has access to. So again, it's very needs to be protected to a certain level. And again, please seek legal counsel if you're going to implement a policy.
We've had a question on the clothing side. Do we have any idea how long the virus lives on cloth? Would there be a best practice as far as if somebody tries something on, should they let it stand for 24 hours? Any guidance in that realm?
This is Dr. Board. I don't know that I can, off the top of my head, provide any accurate guidance. There have been some early studies that looked at, survival of virus particles on various surfaces. There's a lot of caveats to that, though. So if I'm doing a laboratory study and I'm trying to figure out how long a virus particle may live on a surface, if I use a very, very sensitive measure, to detect virus particles, I may be able to detect them in incredibly minute quantities that would not, in a real-world setting, necessarily be enough virus to really actually infect someone. So you have to read those studies with that caveat in mind. So I don't know that we have a clear answer from a medical standpoint on that. It's a great question. It kind of goes back to what's going to be the simplest way to manage that, right? So it may be easier to just say, I'm just not going to have fitting rooms and have people try stuff on, because they're going to spend a lot more time having that piece of merchandise very close to them for a long period of time. There's a higher conceived, potential risk for contamination. So we're just not going to have fitting rooms. That's one solution. Hanging it up for 24 hours is certainly reasonable, although I can't point to any specific evidence that says that that's the right time interval or not.
I would just add to that, Dr. Board's correct. The studies I have seen have focused on surfaces you'd probably encounter more likely in a hospital setting, because they're trying to pinpoint on that. I want to dovetail, I was going to mention, as someone just asked about gloves. So gloves, I think, are a decent solution. I think one way is it's easier to have your employees be the ones who wear gloves versus offering gloves or requiring gloves. That gets back to the masking of every one of your patrons. You might say, well, you know, I'm going to be wearing gloves and I've touched a lot of pieces of clothing or a lot of products, but we still know that the last stop on the train, so to speak, should be asking your employee not to touch, you know, the gloves come off and the hands are clean before they would touch their face or they would eat or something like that, because you would probably get into a supply issue if they were going to change gloves constantly, let alone having any possible irritation in their hands from changing gloves so often, hands getting sweaty and those sorts of things. I hope who submitted that gloves question that got to what you were wondering about.
Yeah, so hand hygiene, gloves and things can help mitigate a lot of the risk about concern around contaminated product or surfaces. So I think those are going to be your, more flexible mitigation strategies.
So maybe if we go back to mask for just a question, or just a second, there's been a question about the proper donning and doffing of a mask. You know, there's masks are a potential use. They may be a good thing, but you can also create a bad thing if you're not using them properly. It goes for gloves as well. Can you maybe touch on the proper usage of the mask?
That's a great question. So remember that a cloth face covering or cloth mask is for what we call source control, meaning it's not to protect myself as the mask wearer, but to protect everyone around me in case I have either a very mild illness or I'm in the pre-symptomatic phase and my cough or sneeze could contaminate surfaces around me. So the thing is, if I wear a cloth mask though, you know, if the mask is very loose fitting and there's big gaps on the side of my face where the mask is not close to my face, if I cough or sneeze, that stuff's going to just go out laterally instead of straight ahead. If the mask is never washed, if it becomes saturated with moisture, it's going to be less effective as a barrier. If I'm constantly touching my face, or I put my hand up to my face and cough into my hand and then don't do hand hygiene or anything, and I'm touching things, that can mitigate or reduce the effectiveness of that as a public health measure.
What are a few quick things that a small retailer could easily do? Thinking about, you know, counter surfaces at checkout and keypads for when you're checking out if you're using a credit card. Any tips you could provide them in that world?
I think you have to look at that space and think about all of those different solutions. So one is, you know, can you distance, you know, what's the distance between the person at the register behind the counter and the customer? Is there a way you can increase that distance a little bit? Can you have a bottle of hand sanitizer literally at the elbow for the customer or the employee to use at the counter? Cleaning off that counter surface on a regular basis. I've seen some retail establishments put up a plexiglass barrier so that there was a piece of plexiglass that was provided, again, some way to provide, you know, sort of direct, like a sneeze guard, so to speak, in case the customer didn't have a cloth face covering on. I think it's all of those things in combination, and look at your workspace and see if any and all of those. Going to cashless payment if that's viable for your business, as part of your regular sanitary and cleaning routine. You know, somebody with gloves on can wipe down, for example, the keypad with an appropriate cleanser for that device, wiping down those areas regularly, having spots on the floor so that customers aren't stacking up 6 inches apart right at the register, so that they're maintaining social distancing as well. Just some thought.
We've had some questions, obviously, on cleaning supplies and masks. One of the things that we are doing on our website, the GFW Inc. website, and our COVID response page, we've provided a link there to local companies that are producing masks, some national resources for people to reach out to, as well as on some of the sanitizer and cleaning supply side, making sure that we're getting information out to everybody. So There is some of that on our website available, and we'll continue to work on that to create any resources that we can. I want to thank our presenters today for everything that they have done. I want to thank all the partners, Greater Fort Wayne Inc., Parkview Health, the Allen County Department of Health, and the Northeast Indiana Regional Partnership. We're proud to be able to bring this information to you today. If you have any questions, please continue to let us know. The Parkview Business Connect website is open and is available for people to ask questions, and they will be getting back to you with those answers in a timely fashion. So I want to thank you all for joining us today, and I look forward to visiting your locations and making sure that we can do so in a safe and healthy fashion. So thank you very much for joining us.